Well, we've got another big headline coming your way. Starting in 2018, nearly half of large U.S. employers could have health plans that will be hit by a brand new tax under Obamacare. It's called the Cadillac tax. Employers will have to pay a 40% tax on these plans, and the additional costs are being shifted to you. Plus, more premium hikes are likely on the way beyond what we've already seen. So, Mr. President, what did you say again about premiums not going up under the Affordable Care Act? Well, joining us is Dr. Reisman. He's a cardiologist at New York's Cardiac Diagnostic Center, and Cheri Jacobus is back with us. Doctor, what do you make of this Cadillac tax?
I think this whole health care plan is a disaster. Insurance companies are making a lot of money. Patients are getting hurt. They can't afford the deductibles, the co-pays, the co-insurance. And it's just another negative feature of what's been going on. The whole healthcare system in this country probably needs a total redo. And we need to look at other systems in other countries that seem to be more cost effective. The United States healthcare system is not there. It's a big problem.
Yeah, you know, Dr. Reisman, Cheri, just made a great point. And when we're talking about companies, the big companies that are talking about this new tax in Wall Street conference calls, it's companies like CVS, AT&T, Boeing. You know, this is a big deal, and the fallout has yet to be felt, I think.
Yeah, and they're just going to pass it along to someone. Someone's going to end up having to pay for this, and it's probably going to be, you know, the little guy. They're going to pass it along as far as they can. Is this now essentially like a luxury tax on healthcare? Is that what this is?
Yeah, and
I mean, it sounds like it. Maybe I got the terminology wrong, but it's starting to sound like it's just a good old-fashioned luxury tax on your health care plan.
Yeah, that's right. And Dr. Reisman, here's the thing, too. Labor unions did not like this tax at all. And you've certainly seen in your practice, you know, a worker could have a spouse who has a chronic illness, and those health benefits, they're not Cadillac plans. They actually help pay for, say, a spouse who has a chronic disease.
Yeah, in my practice at the New York Cardiac Diagnostic Center in Manhattan, I've been running that for 27 years. We've seen a big change in healthcare. And what we've really seen going on is premiums are going up for patients, deductibles are going up, and people don't always understand what that means. And let me explain that. A deductible could be $2,000, $3,000. So your insurance doesn't kick in until you've spent that out of pocket. Then there's a co-insurance, there's a copay. Your prescription costs have gone up. They used to be $10. They could be $50 now. So what's going on is the healthcare companies, the insurance companies, are charging more money, cutting back what they're paying for care, making a lot of money, and the people who are getting hurt are the patients. And it's a big problem. It's not only the insurance companies. Look at the pharmaceutical companies. How many pharmaceutical advertisements are on television now?
Right. How
much are the pharmaceutical companies charging for new drugs that are coming out? Falsely claiming it costs so much money. You know, it's just it's a whole problem.
All right, Dr. Reisman, thank you so much for joining us tonight. And Cheri Jacobus,
Pleasure.
you're always terrific.